I know. My name is Amy Stewart, and this is my career speech, and this is my audience. And this is note card 1, note card 2, note card 3, note card 4, note card 5, note card 6, note card 7, note card 8, note card 9. All right, here we go. And I did them all upside down. Okay. So today we are going to be talking about how to become a CCRN. Today in modern entertainment, you see nurses on television every day falling in love with doctors and getting high in the bathroom. That's not really what nurses do. They are an important part of the hospital setting. Being a critical care nurse is something that takes time and discipline to achieve. Nurses no longer walk around the hospital with a white hat and heels. Without CCRNs in the nursing field, the high care of the patients would not be at such high degree as today. There are many types of specialized nurses, but CCRNs is what we're looking at today. First, a nurse must complete the basic RN course by passing reports from the state that the nurse wishes to live or practice in, as stated by the Board of Nursing. This can be found on the www.bond.texas.gov. Then the nurse must enroll in an RN CCRN course, and then pass the CCRN board, which is one test. I had an interview with Linda Nix, who's a nurse at St. Paul Hospital, and she said the time frame was 2 years to complete the course, and with one online test with a final grade to get your certificate. While you're in the program, nurses learn a lot of specialized fields. They become certified in the NICU, which is an ICU, which is taking care of babies, which is PALS, which is Ped Advanced Life Support. They also do Adult Advanced Life Support, which is called ACLS, and they also do EKG readings, which they read the strip, which is from the EKG machine, and then they can treat without a doctor's interpretation. The scope of practice changes when an RN becomes a CCRN. They are highly trained. They can place central lines, which goes in there, which delivers high levels of fluids or blood to the patient. The nurse can also intubate the patient if the airway is lost. Intubation is when the nurse places a tube into the patient's trachea, and then it helps the patient breathe, which is shown right here. The nurse can now, being a CCRN, place chest tubes, which will help a lung when it's deflated, which is shown here. Now let's look at some careers that nurses can hold. As a CCRN, it can range from hospital to EMS. Nurses normally will work in the ICU with a CCRN, and they have a ratio of 1-to-1, one patient to one nurse. They can join a transplant team, which helps doctors to harvest organs, and they can also become care flight nurses, as shown on the Care Flight website, which states that a flight nurse must have a paramedic and have at least 5 years of ICU experience while holding a CCRN. With a CCRN, you also will make more money. You'll have an increase in pay. According to the ADN nursing website and CTC, nurses make an average of $60,000 to $70,000 a year, but an average CCRN will make $70,000 to $97,000 per year. In conclusion, being a critical care nurse is something that takes strong education and even stronger heart. Thank you. And then there was my audience.
Wait, Marcy.
Okay. Oh, yay! Good job. Yay.